what are some of the, like, if you can give us like 1 or 3 simple kind of things you tell patients that really resonate with them on how to manage their stress response? Because so much of it is exactly that.
So one of the tools I like to use is the physiological sigh, and I use this a lot for patients who have a tendency to err more on the anxiety side.
A sigh, like
A sigh, like a sigh. In fact, we do that naturally. You know, when you see children, when they cry, they that sigh actually is a very quick, rapid, like, yes, activation of your parasympathetic nervous system, which is a fancy way of saying the nervous system, the part of the nervous system that's responsible for resting and digesting. So the physiological sigh is, I'm going to credit Dr. Andrew Huberman, a neuroscientist who actually came up with it. It's actually 2 inhales and 1 long exhale. If you do it 3 physiological sighs, in consecutively, you usually feel a reduced sensations of stress, a marked reduction in sensations of stress.
I do feel better.
So
cool.
That's one of the quick tools. But when it comes to stress, at the end of the day, you can choose to be a reactor to the events that occur around you, or you can choose to be an observer and actually create the outcome that you want to create.
In what way? How?
Most people who are chronically stressed are reactors.
Right.
What I mean by that is they are just responding very quickly rather than slowing down and says, hey, is this something that needs this level of my attention?
Right.
And mindfulness is one of the things I like to use on some people. They're not for everyone because it does require some practice and it does require some introspection, which can be quite difficult for some people who've received trauma, actually.
Right. That makes sense. Yeah, and managing stress is such a key facet of functional medicine. And a lot of times people just don't realize how much stress they're under and think this is just life. But it's so important to be aware. And next time you're in LA traffic, try the sign, because it could just help in terms of risk. Because so many things you just cannot control. And it's like, how do you be in this place of acceptance and realize that at that moment? Because that can really help all these micro cortisol peaks that just keep happening in your day, where cumulatively your cortisol is high.